everybody. I'm Susan Collini, and I am speaking on behalf of Age of Innocence, the Collini Laser Clinic, the Renaissance Center for Plastic Surgery, and Dr. Francis Collini. And as you can see, we are, if you can't tell by the distance, we are 6 feet apart, so we did take our masks off in order for you to understand us a little bit better, because sometimes the masks are muffled. And we are coming back because during our quarantine time, we were doing the daily updates, the roundtables and everything else, and we got lots of requests to start doing this regularly. So unfortunately, we were a few minutes late to start today, so we apologize for that. We were scrambling because we were in service today, and we're going to talk about that for a minute. But we're going to come to you once a month, the first Wednesday of every month at 1 p.m. The time period we're going to keep between a half an hour to 45 minutes, so it's going to depend on how many questions we have. We are going to be open in the future for requests from you, and so we hope that if you're really interested and you really want to find out about something, it gives us time to do a little research and present the best information that we possibly can. So we're going to start this because we did advertise this yesterday on Facebook so that people could tune in for us, and we thought we'd start this whole entourage. First of all, I'd like to introduce everybody. So here today we have Ronnie.
Hello, everyone.
Ronnie is our guru of all gurus in the center, from medical assistant to surgical tech to fix-it man to computers, you name it. Ronnie does whatever the rest of us can't figure out how to do it. And then we have Derek. Derek is the director of the laser clinic. Then you have myself, I'm the administrator here, I'm Susan. And then to my left we have Karen, who's one of our aesthetic nurses. And then we have Sarah, who is new to us, so she's a new face, and she is now the manager of Age of Innocence and does our marketing for us. So we're really happy that Sarah's with us. And of course we have our Ashley, who is our esthetician. Hi. And Ashley going into the nursing field as well. So you have a variety. Hopefully in the future we'll get Dr. Collini to be able to jump on board periodically.
Busy man.
That's right, that's right. And next month, and you'll see some of the staff change during some of our roundtables depending on availability and what their expertise may be. So today's topic is really, again, introducing us and letting you, our consumer, our patient, our patient, letting you know why you want to choose us. So today's topic is just that, and I'm going to have everybody chime in, because sometimes people don't know why they should go to Dr. Collini, a board-certified plastic surgeon, or a state licensed facility, or to seek out the professional that you need to seek out. Because as you know, the internet is swarming with all kinds of information. You don't know what's real, what's not real. So hopefully we'll be able to debunk some of this, and you'll know what we think, and hopefully you'll like what we think. So questions are available too. I know Ronnie is keeping abreast.
Ask away. Yeah, I'm on here looking for questions. So if anybody has any questions, don't hesitate to ask. We'll answer them right here.
And I'm sure people will get more used to that in the future. So this might be a dry run for things so that you can get used to us in the future. Derek, I'm going to let you start and let people know why they want it, if they're thinking about any kind of laser or resurfacing, why they want to come to the Collini Laser Clinic.
Absolutely. So when you're choosing to get a laser or do anything that is getting results or can have downtime that's extended, you really want to make sure that you're seeking out a medical facility and somebody that's also overseen by a physician. I think is very important as well, that we have that person to bounce things off of. But what's important with our facility and why we get such great results and why sometimes people will ask us, and this is a question that we'll get, your pricing might be a little bit higher than someone else's, or for hair removal or something like that, a treatment like that. So one thing you don't realize is when you're doing a laser, you're working with very finite pieces of equipment that have to be maintained in order for them to work properly. And that could be a matter of, I've had someone come in that had 20 laser hair removal treatments and didn't have a result from that. Now, they're worried about our upfront cost, but the money that
They went somewhere else
they
to
went
have that.
somewhere else to
Not
have
from
that
us.
done. So the money that they put into using this piece of equipment that wasn't held up to the standards of that equipment and how it needs to function really, really hurts your results, and it really hurts where you're trying to get. So our machines, you know, as to where someone would do 20 laser hair removal treatments, we do 6. All of our machines are maintained painstakingly. All the parts are new. A lot of these lasers have replaceable parts on them that have to be constantly maintained in order for it to function properly. So in our facility, that's constant. We are always upgrading. We are always maintaining. We keep a very good relationship with the companies, and we only buy from the specific companies. We try to not go outside of their little branch because then we're supported. So that's a very important thing. And the other important thing is cleanliness. When we're using these lasers and we're getting into deeper parts of the skin, your level of infection goes up. All of those things can be a risk. So if you're going into a facility that's not monitored, you know, we are a AAA-HC facility because we hold ourselves to the absolute highest standard, and that's from top to bottom in our 3-story facility. So when you're held to that standard, you have a lesser instance of complications, infections, anything like that, and that's where you get into permanent damage from lasers. And that's why we try to eliminate those fears for people, because lasers should be used, you know, they could be used gently, they could be used to totally change the skin, but we want to eliminate the fear of complication, and we have a very low instance of complication, and we've actually, knock on wood, haven't had any complications with our lasers. And it's because we hold ourselves to a standard. If you're ever going to meet with one of our new clinicians, they have been held to a competency standard that is very different. It's our own level of competency. In a lot of trainings, people will come in, they'll get a training for 4 hours, and all of a sudden they're put out into the world with a laser. We don't let people touch a laser until we know that they absolutely know
really comfortable.
what they're doing. And we put ourselves out there, and we put ourselves as the guinea pigs because we want you to have the absolute best result, and we want to make sure that we're giving all of our customers the most satisfaction and the best results that they can get.
So I'd like to chime in here that a lot of times patients choose laser because they feel that the treatment is non-invasive. But lasers can be invasive, as we well know, trying to determine what we'd like to laser. You can take off lesions, you can treat wrinkles, you can treat fat, you can treat hair, you can put it on, take it off. So there are lots of different things that you can do with lasers. The wonderful thing about our center that I'm very proud of, we've painstakingly researched all the lasers out there. We now have 15 levels of capability with lasers now. So 15 different types of machines. We do everything on the market. So everything that you could possibly want, we can do at this center. It might not be the same name brand as something else you may have seen somewhere, and we'll tell you why we chose the name brand that we have and why we'll do it. So we'll give you a really good education. All you have to do is come up with the question. So that's one thing that I'm very proud of. And I know all of our estheticians here have been working at different levels with the lasers, so that, you know, you might want a specific person and they might not quite be qualified for that laser yet. So we will make sure that you have the best resources possible, the best laser for what you want to achieve, and also the best technician for the outcome. So I think that's really important.
And I think another really important thing for us, certain different facilities will get a monitoring physician that's not really always necessarily present for them. So one of the things with us is, if I'm working with somebody, let's say I'm doing a cool sculpting consultation and we're looking at a high price range, this is when I can say to them, hey, plastic surgery or liposuction is actually your better choice that's when
Based
we
on the
go
financial
based on them
investment.
financially, on their body. So we're able to hit all of those different ranges of a treatment.
So choosing the best for you based on what you need.
From
That's-
facials to surgery.
That's right.
We have it all.
That's right. So at this point, I'm going to talk to Karen and let her tell you why you want to come to Age of Innocence once we can start doing more
Absolutely.
things because we treat Age of Innocence, it's a salon and a day spa that we're all affiliated, but we do everything to a higher caliber, and I'm gonna because Karen is our nurse and she oversees a lot of the things that we do to make sure that everything is up to our standards in the facility.
I think you could look at Age of Innocence as more than just a salon, but it is a skincare clinic. And as Derek said, we have lasers, which are wonderful. We also have upstairs chemical peels, facials, all kinds of different skin rejuvenation. What I find is a completeness of our facility is that we not only can do the procedure and send you home, but we can give you excellent skincare to go along with it. And I always tell my clients that the skin is an organ of the body, and it's the largest organ, but it's the one we probably take the least care of. Any organ of your body needs diet and exercise. So for your brain, you read. For your heart, you walk. For your skin, you're going to use the exercise of lasers or chemical peels, but the diet is the stuff that you put on your face. So we will walk you and talk you through that so that you have the best skincare to go along with the procedures that we do upstairs too. We can guarantee you that our equipment upstairs is clean. We use precautions between clients, especially now in this COVID situation, and we take pride in the fact that we have this facility to offer to you.
I want to chime in one thing here. Other than the masks and taking temperatures, we pretty much were doing the same thing before COVID and after COVID. So I want everyone to realize that the cleaning factor wasn't
It's nothing new.
It's nothing new for us.
No.
We've been at that level all along. So I think that that's really important. So thanks, Karen, for that one. I love the analogy too about the diet, and we
Yes.
do have great skincare products, and we cherry pick. We do have our own line, Kalini MD, that I'm very proud of. But we're always working at bringing new products to the line, and when we can't find a specific product that fits a certain need, we do have some other great lines. We have Jan Marini Skin Research, we have Revision, and we have Aven from Paris. So we do have a couple of other lines besides our Clean MD because we want to bring you the best product that we think will work for you. And that's why we do what we do with those.
And I think too, another important thing, this is something people notice when they come into it, we're a passionate group.
Yeah.
So we're very,
Passionate.
we took a long time to find all of our group that is very passionate about what we do. We're talking about this when we're off of work. So we're always looking for the next best thing, and we're always looking for the next best thing for our clients.
And what the latest technology
And what the
is.
latest technology is, we're all researching all the time.
And we have a diversity of age. So I think that helps us to accommodate each age group from teenager to those of us that are on Medicare.
Did you really have to say that?
Us and whatever. The other thing that I find interesting, because I've been here 20 years, sometimes our clients will come in and want miracle stuff. If you're gonna come in and not be compliant with the skincare we give you, or if you say, I'm not gonna give up smoking and I really don't like water, there's not a lot we can do for you without some help on your part.
Yeah.
So I think you have to be compliant with
You have to
us,
want to have,
and
make it
then
work.
we will guarantee you the best skincare.
We'll get you somewhere.
Yeah.
That's right. We've got lots of before and after pictures, which are great. We are working on our website, so hopefully we'll have the new website launched. It will have the same look as far as some of the artwork that we do, but we're gonna have a lot of new before and after pictures that you're gonna see, a lot of new updated information where you can get access to the information very quickly, Q&A, people like that. You know, I've had to learn to get into the millennials' choices of the way they surf everything, and so I still learn that, and I've got Ronnie for that. What, Ronnie, this machine's not working.
Go fix it.
I know, so on this note, I'm gonna move to Sarah now. I know that she's new to us, so she's really in charge of marketing, so we're throwing some things out there. So I want her to just say hello to everybody and know that she's going to be the face and the voice that you're gonna hear when you first call up to Age of Innocence and you're not sure where to go. Sarah's gonna help direct you and.
Yes, hello everyone. So I've been here for about 2 months now, and I'm learning the ins and outs of upstairs in the salon and helping out with the laser clinic and helping out with Lauren's hair and tattooing if you're ever interested in cosmetic tattooing. And I'm just here to answer any questions and set you up with appointments and steer you in the right direction for what you're looking for here.
I liked how when you started and you pulled our menu drop down, you said, wow, you guys do a lot here.
There's a lot more here than I ever expected.
Anticipated.
Yes.
And that's why we really needed Sarah, because we really need somebody to coordinate those efforts, because we're a very busy team and everybody was trying to work the desk and work the phones in between customers, and it just, we were dropping the ball a little
So
bit.
our level of communication
That's
is going to
right.
be a little bit better
So
this year.
Sarah is a great addition, and we're really excited. And by the way, did I tell you that her last name is Kalini? So anyway, on that note, welcome,
Thank you.
Sarah.
Thank you.
All right, and now I want to bring in Ashley now and let you have a few words on your upstairs and downstairs and what your thoughts are on why you think that this is the place to be.
So I've been an esthetician now for a little over 3 years, and this was my first choice to come work here because the reason why I chose to work here and why I think people should come here for all your treatments is that we like to marry, like we said, between doing facials and chemical peels to doing all the way to the surgery aspect. So there's so much knowledge and information, and it's constantly changing and evolving, which as somebody who's working in this field keeps it very interesting and keeps it very, you just want to keep going with it and learn everything. But also too, so I worked in the upstairs for a while, and as I got busier and busier doing lasers, which I'm learning now too, Derek's an amazing teacher with lasers, and I'm slowly learning all of that, and then I decided to be a nurse. I had a very life-changing surgery that inspired me to do it. I can get into that at another date. But
That's a future episode.
that's a future episode.
What you chose here.
And also too, I have some nurses in the family, so I think doing nursing and aesthetics like Karen does is really inspirational because you have a lot of health aspects that go in between your skincare, such as your diet and knowing how sun exposure is not the thing that you want to really be doing to yourself. So I think that it's a very good choice to come here, and also marrying the two with working.
Broad spectrum, cover it all.
Sins of your 20s become your enemy at 60.
So if you haven't figured this out, one thing I didn't mention in the very beginning, that we are a plastic surgery center, and we are here to help make you look as good as you feel, and that incorporates a lot of different things. So we've hit on the peripheral, we've hit the lasers, we've hit the aesthetics. Unfortunately, we're not able to do facials yet, so when that goes back into effect, we will be doing that. But we can do a lot of, because our lasers are a different aspect, and we're in the medical field, and we're all gowned and gloved and that type of thing. It's a different genre, and there are 2 different licensures, so I know people want us to cross that line, but I did know from the State Department that facials are still not allowed yet in the state of Pennsylvania. So as soon as we can do that, we will be right on board. But we can help you
Done a
still
few
with all
foreheads.
those. So as long as you have your mask on, right? Necks and
Done a
foreheads.
forehead or two.
Somewhere in between.
They were like,
it's
just
all up.
please resurface my forehead.
So, but we can do a lot of things with home skincare, as Karen mentioned before. So skincare products, if you haven't started on anything, jump on board. That's the baby beginning of taking care of yourself and taking care of your skin. The next aspect is really we're gonna talk about surgery, so I'm gonna bring Ronnie into this equation a little bit. So, the next part of what we do is we're, you know, an actual state licensed medical surgical facility. So we do surgery here on premise. What does that mean? Can you do surgery without having a license? Well, only if you want to be reprimanded by the state, but no, you need a state license, so we do have our state license. We also have what's called the AAAHC, 3A's HC. That is the organization that certifies ambulatory surgery centers in the entire country. So people may have heard of JACO. JACO certifies other organizations like hospitals and different things like that. They can certify ambulatory surgery centers, but AAAHC is the group that does do that, and we have that certification, so we're very proud of that. We're also a Medicare certified center. So those three things ensure that you've got the best credentialing of where you can go. The staffing, Dr. Collini being a board certified general surgeon and a board certified plastic surgeon, ensures that the overview of everything that we do is to the best of our ability and other places. I can say that we've had patients that have come from out of the state, out of the country, and they're incredibly impressed over our wealth of knowledge, the things that we do here, and we try to get through the things that we do as easy as we can for you, but sometimes some things are a little painful, some things are a little bit uncomfortable. We are here, we provide, you know, anesthetics where we can, that type of thing. But as far as the surgery goes, people think of a plastic surgeon as just doing abdominal tummy tucks, facelifts. Of course, we do those, and those are important. They keep the lights on in the facility. But Dr. Collini also takes care of all kinds of emergencies, from major facial fractures,
Major tendon lacerations.
your hand, dog bites,
amputations, dog
amputations. You know, you get cut, skin cancers. I mean, we're doing a lot of things.
Non-healing open wounds.
Breast reconstruction.
Breast reconstruction,
Yeah.
breast reduction.
Yes, and which is great. And
Yes.
Dr. Collini does work at the hospital. He works at General Hospital in Wilkes-Barre and also at Geisinger Wilkes-Barre. So that whatever insurance you have, we do take many insurances. Whatever insurance, if your insurance dictates where you need to be, that's where you'll go. So that's a good thing that we choose to help you in that endeavor. Unfortunately, not all insurance companies, like each place, they cherry pick too. So, but we work with you, and we do work with a lot of insurances. The nice thing about us also is that we have almost, I don't want to say 100%, but almost a 24/7 accessibility.
Yes.
And you can call the center, and if there's any type of injury that you sustained a laceration, or you were hit and injured at a sporting event or whatever, you can call us, and we really do handle that
Yeah.
situation as quickly as we can, or direct you as to where you need to go.
Yeah, we have patients that will go to the ER with a facial fracture and actually request us, just because they know us or have heard of us, and this is where they feel comfortable going.
Right, and you knowing the operating room side,
Yes.
Ronnie, you want to have a few words for our operating room, and also you'd see Ronnie on our office days, so
Yes.
he's helping with all
I am
the.
everywhere.
Jack of all
He's
trades.
everywhere. When we say he's everywhere, he's everywhere.
I'm everywhere. So yeah, when you come to our facility and decide to have surgery, if it's able to be done in-house, it's great. You come here, we have our pre-op room, we get you set up. Karen will get you all roped in, get your IV started, get your antibiotics in, whatever you may need there, and then we'll get you back into our OR. You know, tip-top in there. We keep it nice and clean. All of our instruments are perfect. Our beds are perfect. We really take pride in that. And then our recovery room is beautiful too. You'll meet Karen back out there most of the time, and she'll get you back on your feet and recovered and home.
I think one of the really important things too about, especially in the current situation, and one of the things that people don't want is they don't want to be crowded.
Yeah.
So you have a facility to individual patients are seen. I mean, when you're here for surgery, you don't realize that you're walking into a place where
It's for
you're not really around sick people. You're not dealing with that. It's just you in there. So I think with the current situation and how things are, you could feel a little bit more at ease having your surgery in our center.
And then on our office side, I mean, we take, especially now with the COVID situation, we take, the temperatures at the door, everyone's wearing their masks, we're taking the precautions, getting you back into the patient room at a, efficient pace, hopefully not here too long, we're keeping our waiting room times down, keeping people out of here. So, we're doing our best, and we definitely see people
We do,
benefiting from that.
we have an entire list of things, and we said that originally when we were doing when we couldn't work.
Yeah,
And
that
we
was
were
hard.
doing this to introduce the things we were doing. We actually have somebody that when we have office hours actually goes to the facility about every half an hour and wipes down door handles, doorknobs. Patients cannot get into this facility at all. Every single door is electronically locked, so people aren't just walking in randomly. We're able to pace everybody at a reasonable rate, making sure that people are distant. And knock on wood, we've been very successful at it. We take everyone's health and their well-being very, very seriously, and we address it to the best of our ability, always.
Always. And that's, even before COVID, we've been very, when you're back in the room with the doctor, we want to make you feel very comfortable. We want to make the whole process just easy for you. I want you to feel comfortable when you get in that patient room. I want to go through your medical history, nice, easy pace. I want you to feel comfortable talking, and then get the doctor in there and get your problem, whatever you want to, it might not be a problem, it might be something, an upgrade. Just get it finished for you.
That's exactly right. And I know, I always try to tie in anything that's happened like in the last week. I know that we did happen to have a patient that had some really aggressive surgery and was not, I don't think anticipated the recovery that they were going to have. So I'm avoiding saying he, she, so that we don't identify anyone. But, to those people that may have been through our center and have had experiences where they think it should have been more perfect, we are doctors, we're medical people, we are clinicians, we're nurses, we're estheticians. We do the very, very best of our ability, and sometimes things take longer. They might not always be comfortable. We try to, take that into consideration. We like to think that we are always accessible by phone, or if you need to come in and see us, doctor will see you always. I mean, it's amazing to me that he can be here at 10 o'clock at night and somebody will need him and he'll say, come on down, or it's 7 o'clock on Sunday morning. It's the same type of thing. Or holidays, right? And that's very, very rare in this day and age where access to healthcare is really a challenge. And when you need something done, that's really very
Having
difficult.
24-hour access to a board-certified plastic surgeon's
I know,
it's a
he's
good
really
thing.
accessible. We give out his cell phone number to patients, so they have him.
One of the things I think is important with you is how long have you been here?
Oh my goodness, well, we've been in the valley for almost 31 years
So
now.
this business has been in existence
So our
for-
business now, we started this business 26 and a half years ago. So we've been here a long time. If you haven't known of us, I'd like to think that we do, people know us. But we take pride in the fact that we're still here and we're still relevant. And not only that, as you can see now by the youngsters I have in front of me, that we're keeping on the cutting edge with all the things that we do. We are not stagnant. We educate ourselves by the minute. As a matter of fact, we're in the middle of an in-service today. I think we might have mentioned this last week sometime.
Yeah, we did a little excerpt on it when they came to show us, and it was a no-brainer because the treatment was phenomenal.
Right.
Susan and I both had. Do you want me to say
Yeah, you
it?
go right ahead. Absolutely.
We have acquired a CO2 laser, but this is a brand new technology of CO2 laser. It's called the Tetra Microtessa. When people would hear CO2 laser in the past, it was a very scary thing because they
I
would
can vouch for
see
that.
the downtime was incredible, the risks were incredible. They were basically ablating all the skin off. So now what we've learned and what we do in most of our lasers in the facility is they are fractionated. So when you fractionate something, you're getting little pinpoints, but you're leaving healthy tissue in between. And why that's so important is because you don't have the downtime. When you don't have all of this downtime that you're working with, you have less risk of inflammation, of post-inflammatory pigments, of any complications that you might be able to get with it. The other thing is, Susan and I did, it's called a cool peel. So this is a new technology that is specific to this machine. So we can dial back the CO2 laser so much that we're giving you basically a laser chemical peel, but we're still getting into areas of the skin that we can build real collagen and get real results with it. It's just that you're not going to have all of that downtime. So we did a treatment, no numbing, very minimal discomfort, and by the next day, just a little bit of dryness, no erythema. It was like nothing.
It was great.
It was phenomenal. So a CO2 laser, what you'd really want to be focusing on with that is if you are struggling with some deep set lines and wrinkles, we can really eliminate and correct those with very finite detail with the CO2 laser. And it was our final step in our arsenal of what we
This was
needed.
the little hole that we
We
had.
had everything to build your collagen, tighten your skin. This was just a little finite piece that we needed for the resurfacing that we want. Now, if you were looking for something like an ablative CO2 laser, we are capable of doing that, but that's when you're stepping into an OR setting and you're working with Dr. Kalini. But it's an exciting laser, and it can be used with other components that we have. I know radio frequency microneedling is a huge thing right now. So that's going to help people build structure, tighten skin, and lift up the jowls a little bit. And then we can go in the same day and give you that beautiful resurfacing. And it's a very minimal downtime treatment, but has phenomenal results. And you'll build collagen for up to 6 months with that treatment. So we're constantly blending, we're constantly evolving, and we're constantly buying new equipment.
Oh my
I think we just
ouch.
like to shop.
So the other good thing is so what do you do if you're out there and you're thinking, oh my gosh, during this COVID time, I'm feeling a little down, I'm feeling a little sluggish, I haven't been taking care of myself, haven't had the opportunity. So come see us for a consultation with Karen or Ashley or Derek. You'll get Sarah on the phone first and she can guide you. But sometimes patients think they want a certain procedure, and once evaluated by our professionals, we can determine that maybe something else might be better for you. And that's the whole beauty of this center, is that there are so many options and our menu is so vast that we really want to pick the right thing for you. So you might think you want to come in for a CO2 laser, and Derek or Karen will be looking at you and say, no, I think you'll really have a better result with this. This is actually a cheaper procedure, less downtime, based on the information that you provide us. So if you're not sure, it's okay to be not sure.
That's what we're here for.
That's what we're here for, is to help guide you. We don't charge for anything, any consultation for the estheticians or our Age of Innocence or the laser clinic. You could always talk to us. Anytime I have patients or potential patients that call me on the phone, they get us through our website, they get us through our email, they get us through anywhere, and we're answering questions all the time. So don't ever hesitate. We are here, and we like talking to you. We love to give you our opinion, and you can take it for what it's worth. But we hope that you end up here if you're making those choices to do some, self-evaluation, self-improvement.
We can treat you hair to toe.
Hair to toe.
Literally hair to toe.
Yes, we do. Are there any questions?
We have one question regarding Botox. Is 23 too young for Botox for forehead lines?
So, we have different thoughts.
Depends.
It depends.
Well,
we have sometimes we have those patients that want to try everything and they want to start really young. But we also believe that sometimes the younger that you start with something, the more preventative something is going to be. So I don't like to say 23 isn't. I have known of 23-year-olds that have had Botox if they need it. My daughter was very young when she had the worst cleft here and real movement in her forehead. So it really, we would like to see you and say,
Exactly.
just wait a year or so, or yes, you really are a candidate. So as long as you're over 18 years old, we do take everyone seriously with their questions, because I know your mother or your grandmother might say, you're too young, you don't need that, or your
It
friend.
might not be aging
Right.
related.
It
You
might
know,
not
it's
be
just having
aging
a
related.
static deep line here that someone wants to correct is
Right.
something that it can. Yeah.
Right,
That's
so
very-
So it really is dependent on the person, and we don't just discount you for your age, we really look at the problem that you present with, and we give you as many options for treatment as we can, and maybe there is only one option that we can provide you, but we will give you, every capability that we know of.
And I have people ask me the question of why is it preventative? And I say, well, if you're not doing this, you're not going to get the wrinkles. So Botox will go in and it will stop you from having that muscular contraction to give you that wrinkle in that area. So that's why when you start with no wrinkles, you're not going to develop wrinkles in that area over time. So I started at about 27 years old getting my Botox for prevention and keep this baby smooth.
That's it. Anybody else wanna chime in about Botox?
If anyone's ever interested in Botox, we always run a special the first week of the month, so we're here on Tuesdays and Thursdays, so please give us a call and we'll do a consultation and we'll get
That's
you in.
right, that's right. We drive everybody into the first of the month primarily to give you a little discount, but we force that with the discount because we wanna make sure that our Botox is the freshest that you're gonna get. And Botox is very operator dependent, and also the age of the Botox is very dependent on the quality of your result. And I can tell you that our Botox is always fresh. We're turning it over like this in that 1 week. We try to drive everybody in this area, and I know for a fact that we don't have any Botox that's more than 48 hours old.
In addition, the
go ahead.
dilution of
Oh,
Botox.
absolutely.
Some people sell it by the syringe, and what the consumer doesn't understand is they may over dilute it, so you're actually getting less Botox, but it looks impressive because it's in a bigger syringe, and that's not our philosophy.
Right, you buy Botox by the unit here, and that's the way
You get
Allergan
Botox.
represents it, and so you know how to compare whether you need more or less on your next treatment based on the amount of Botox you receive. So you don't wanna go by the syringe, you want to calculate it by the unit, and that's how we do it. So, I hope that answered the question.
We gotta thank you. You're very
Oh,
welcome.
great.
You're welcome.
Yeah. So at this point, I think we could go on and on forever, but we have to get back to our class. And I want to tell you that next month we will be doing, what's the first October Wednesday of the month? Brian, would you check it out? But I want it, we're gonna have another guest who's gonna be a regular with us. We have just hired a new cosmetic PA, and her name is Marley, and she's sitting over there watching us right now, but she said, I wanted to give you Sarah this time, and so next time, we're gonna have Marley on board, and she's gonna be our other set of clinical hands in this facility, which is fantastic. We're really excited about introducing her.
Yeah, on October 7th at 1 o'clock, it's breast month, so we're going to introduce Marley, as she said. We're going to discuss breast reconstruction, areola tattooing, post-mastectomy radiation, tattoo removal, and scar removal. And we're going to try and get our Dr. Queenie in on that session.
That's
Yeah,
right, that's right.
1 o'clock, right guys?
1
Yeah,
o'clock,
1
always
o'clock.
the first Wednesday of every month at 1 o'clock, so we look forward to seeing you back then. Thanks a lot and have a great day.
Bye, everyone.
Bye.